Learn about leukemia. Leukemia is a type of cancer that affects the blood and bone marrow, which results in the abnormal production of white blood cells. 1 in 63 men and 1 in 96 women are diagnosed with leukemia in their lifetime. Leukemia is the most common cancer in children and teens. Men are more likely to be affected than women. More than 259,000 people are living with leukemia in the USA, and 5-year survival rate is 59.7%. Two forms of leukemia include acute lymphocytic leukemia and chronic lymphocytic leukemia. Acute lymphocytic leukemia starts in the bone marrow where blood cells are made. It is more common in children and adults. It accounts for 80% of leukemia cases. Chronic lymphocytic leukemia starts from the white blood cells in the bone marrow. It mostly affects older adults and accounts for 1/3 of leukemia cases. Symptoms of leukemia: fever or chills, persistent fatigue, weight loss, petechia, that is tiny red spots under the skin caused by bleeding, abnormal bleeding and swollen lymph nodes, and enlarged liver or spleens. Risk factors of leukemia include individuals who are 50 years or older, genetic disorder, family history, smoking, exposure to chemotherapy drugs, and certain chemicals. Diagnosis of leukemia include complete blood count, cytogenetics and PCR test, bone marrow test, lymph node biopsy, and lumbar puncture. Treatment for leukemia include chemotherapy, radiation therapy, immunotherapy, stem cell transplant, and surgery. Prevention for leukemia. There is no way to prevent most types of leukemia. However, lifestyle changes can cut the risk of cancer. Lifestyle changes like healthy eating, regular exercise, giving up on tobacco, avoiding exposure to chemicals, and high doses of radiation. Join a support group of cancer patients and share grief and concerns and learn from other people's experiences. To learn more, log on to www.medindia.net.